so we can decide of what type of implant we're going to put, maybe a small one, maybe a larger one. We can see all that in the digital x-ray. But usually we'll start working right away with the lab work. Once we have the lab results, maybe we can take like a cone beam, which is like a digital x-ray. That way we can see the bone density, the bone level of the bone work, how many millimeters we have, so we can decide of what type of implant we're going to put, maybe a small one, maybe a larger one. We can see all that in the digital x-ray. We can see how close we are to the sinus, just in case it's on the top. Any infections you might have, we can see all that. Once we have done, we can either have the same day the surgery, or we can schedule it for another day. We usually, the first day, we just do the blood work and the cone beam, and then we'll schedule another appointment for the surgery. Unless they want to do it all same day, we can also do it. We can maybe start early in the morning, maybe we can see them afternoon, and maybe be done by 3 or 4 or 5 p.m. They'll be going home with the implant. It usually takes about 2 to 3 visits. Usually if it's one in the front, we'll give them like a partial or a fake tooth. That way they can have something to smile on. Usually the implant needs to stay in the bone for at least 6 months. That way the bone can start growing around the implant. That way when we put the crown, it can be strong enough to support the biting distribution. We usually ask for a week while we put the attachment, put the abutment, take the impressions, and send the impressions to the crown. That way they can do the crown over the implant.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.